It's a small town that functions well. It's a small town that has gone through some rough times, especially with the closing of the Welch's office in 2001. It's taken a number of years for Westfield to revitalize itself, to start attracting talent to this area. But the institutions in Westfield, including Patterson Library, the YWCA, the town and village governments, the McClurg Museum, and the hospital have all worked together, and that we're doing what we need to do to move forward with this community. There's been a lot of success. A lot of young families have been moving to this small rural town because we've got diversity, we've got leaders who think progressively. And it's great to be in a small town where things are moving in the right direction. As a father of young kids, it's terrifying to think that if we had an emergency, the closest emergency room would be Dunkirk or Jamestown. In my mind, that's just not good enough.
When Welch's left in 2002, so much of the town was affected. There were 93 jobs that were lost to this community. And each job, with their families, between $30,000 and $50,000 per employee. That's $3.9 million of income that was lost to Westfield. If Westfield Hospital and the emergency room close, there are 100 positions of full and part-timers, and per diems. There is also training here between the schools, the residents, the Amish. Not just Westfield, it's Sherman, it's Portland, it's Ripley, it's Brockton. There will be it's 5% of the population is Amish. There will be so many people that won't be able to get care. They'll die in transit, especially in the winters. So the winters are rigorous. My family has been here since 1868, and so many of my generations have been through Westfield Memorial Hospital. I have 6 siblings, 2 parents, my grandparents. Everyone in my family directly have used the Westfield Memorial Hospital. It's very comforting as you get older, knowing that there are services that you may eventually need. I've personally already used the emergency room, the Westfield emergency room, twice from anaphylactic shock, and it was in the winter. And I know there are 2 hospitals. It's the Dunkirk Hospital, which is 22 miles, and the WC Hospital in Jamestown is 28 miles. When you suffer something like that, I have antibiotic allergies. When you suffer something as extreme as anaphylactic shock, you have a limited number, so need for speed, and you have a golden time that you can be treated before death. I've actually already died twice, so it's very important for me to be able to be near a hospital. Closing this hospital is devastating to this town.
This is not a dying town. This is a town that's thriving. The Patterson Library is a large part of why Westfield is such a great place to live. It was founded in 1896. The building that we're in now was built in 1908. We've been here for 101 years now. We were built because of a bequest by Hannah Patterson on her death in 1894. We are just one piece of the puzzle that makes things work in Westfield. One of the key ingredients, one of the key pieces of the puzzle is having adequate health services. the Westfield Memorial Hospital is absolutely critical for this small town to be a place where young families can move to and live and work.
My mother lives across the street, and I made it across the street, and she took me in her Jeep to the emergency room, and they gave me care, the Westfield emergency room. They gave me care immediately. I wouldn't have made it to Dunkirk. I wouldn't have made it to Jamestown. I wouldn't be here today.
No amount of hard work, creativity, talent, forward thinking is ever going to replace an emergency room. The closing of Westfield Memorial Hospital, or the emergency room at least, has a lot of parallels with the closing of the Welch's offices. But the big difference is that through a lot of hard work and forward thinking, we've been able to get over that, get past that, and rebuild the community. If the emergency room were to leave, there's no way that we could replace it. It's an irreplaceable and permanent thing.
Because it's essentially a private hospital, and the Westfield Memorial Hospital does not get funding from the government, that they have a say in closing our hospital. I guess I'm really not sure why they're able to make that sort of decision. Anyone that's been in a life and death experience, it's quite frightening. And unless you've already gone down that path, you really don't know.